I'm Helene Castel. I'm working in France, in the northwest of France, close to Paris. It's Rouen, it's in Normandy. And I'm a team leader because it's like that now in France. We have teams. And I'm working also with clinicians. So we are trying to investigate brain pathologies connected to vascularization. So it's mainly glioblastoma and tumor development. It's anti-angiogenics inducing cognitive dysfunctions in patients and animal models. And it's also brain stroke because it involves vascularization into the brain. So today, it was a great opportunity for me to participate to this meeting at the beginning because we are working on chemotherapy, but also on targeted cancer therapy. And I would like to introduce a specific syndrome in patients receiving cancer therapy, chemotherapy, and targeted therapy. And this is the reason I'm here today. I wanted to demonstrate here that chemotherapy, but also anti-angiogenic therapies are inducing side effects into the brain, inducing alteration of cognitive functions. So I will speak about now neuroscientific things. And we demonstrated that, of course, in animal models, it's much more easier. And we can tell you that this is the first chemophobic syndrome reported. So you will understand what is chemophone of chemobrain. I will explain you. First of all, I would like to introduce our consortium. We are working all in the, you can see northwest of France, so Spain is there, and Canada is there. And we are working with clinicians here, so Florence Joly at Caen is oncologist, and she is a very huge professor leading a lot of clinical protocols to investigate in all cancer patients the involvement and the effects of chemotherapy and targeted therapies on cognitive functions in patients, but also fatigue and quality of life. So we are working with oncologists and psychologists in clinic. We are working also with researchers to investigate by MRI the cognitive deficits and brain activity in patients, cancer patients receiving therapy for cancer. And we are working in Rouen to develop animal models in order to investigate brain mechanisms inducing directly by this therapy, chemotherapy and targeted therapy. So what is chemophone or chemobrain? As you can see, as patient reports, it's like thinking for a phone, for the London phone. So it's very hard. It's more than 10 years after the end of the treatment, after chemotherapy or targeted therapy. This is really something that is judged by patients as the priority after the cancer treatment. It is based on 10 years ago on specific reports by patients. And these are, interviews of women after breast cancer and chemotherapy. So this is in our French center. So this is a traduction of what we say. They say, for instance, after the chemotherapy process, I'm confused. I want to do everything. I cannot hold me, but I lose my height and I put my laptop into the fridge. For instance, I struggle the name of people. I know them, but I can't find their name. It's like Alzheimer's disease, but it's not Alzheimer's disease. It's very specific. It's something very connected to short-term memory and very specific to attentional processes. I'm totally dead. I don't know what I have to do. Yesterday, I cleaned the chicken legs to cook with the dish soap, and then in the afternoon, I put my clothes in the freezer compartment. And finally, this other woman explaining that she wanted to go back to work after the treatment period, but she was unable to write painting at the preceding, discussion with the oncologist. So finally, they are really disturbed after the treatment period by the treatment, but probably also by the cancer itself. So why by the treatment? Probably because, as you know better than me, you are really specialist of chemotherapy. In fact, a lot of them are inducing encephalopathy, leukoencephalopathy, but most of them can penetrate into the brain through the brain-blood barrier, for instance. And as you know, it blocks cell division. So the first study, just to make story about that, the first interesting study came in 2007 with an interesting, comparison between controlled healthy volunteers and cancer chemotherapy patients 5 to 10 years after the end of the treatment period. What it demonstrated that under the PET scan, it's possible to measure, as you can see, it's the brain, activity of the brain into the prefrontal cortex here during what we name a short-term memory task. What is a short-term memory task? It's just, how to draw the complex draw of red. It's just a task. You have to memorize how this drawing is done. You can see it's very difficult. You have 30 seconds to memorize. And after that, without the draw, you have to remember, all specificity of this draw. So usually you are not very good, but you have to draw it. And do this process, during this task, your activities are highlighted. As you can see, the chemotherapy patient is, highlighting some interesting area during the process. So it means that you have modification of the cerebral blood flow and cerebral activity, but also this patient have alteration of the performances for the drawing of this specific task. So it means that you have alteration of specific area into the brain, the prefrontal cortex, for instance, and also the parietal cortex involved in the short-term memory. But this study, you are, clinician and you know how conducted studies. It's not well done because control volunteers are not very equivalent to patients with cancer, chemotherapy, and the rest of the life. So the second study here, published in the same year, is very interesting because it concerns two homozygous twins, two women of 60 years old. They are very interesting because they were 60 years old, we were not married, so they lived together their entire life. They live together, they are similar, they are very active, and the control one is healthy, the second one is fine, but she had cancer and was treated by chemotherapy. So after the end of the treatment period, they analyze brain activity by MRI, as you can see here. They have the same genome and the same life. So here is to measure executive functions. So how we can measure executive functions? You can do the test yourself. In fact, we do the M-back test. The M-back test, it's really easy for the one-back test. It's how to determine that the second character here is the same. So the patient has to push on a button when he can hear M, R, the second M, just after the first one. It's quite easy, So to do this test, the healthy girl was really fine and she didn't activate a lot of, brain area. But the two-back test is much more difficult, and the three-back test becomes to be very difficult, even for you, even for me. It's so difficult that you activate more, more cortex area. But for the cancer and chemotherapy women, it was very hard, even for the one-back test. She has difficulties, and she activated a lot of area for this easy task. Finally, it means that you have low efficacy for executive functions, deficit, and cerebral fatigue. So, what is chemophone and chemobrain? It's a lot of things. It's a combination of cancer, chemotherapy, emotion, stress, anxiety, and fatigue for patients. And there is, I don't know if it's interesting for you, but a specific international committee on cancer task force, we are member of that now established a lot of things in patients and animal models. Neurocognitive evaluation guidelines for these specific cancer patients treated by chemotherapy or targeted therapy, clinical networks, imaging procedures, and rehabilitation processes. But now, what about targeted therapy? Are these targeted therapies able also to induce and to modify cognitive functions in patients? What is the base to evaluate the direct effect? Without emotion, without depression, without cancer, the direct effects of chemotherapy and of targeted therapy. Animal models can be found and can be used in neuroscience to evaluate behavior, so anxiety, depression, cognition, and also neurological mechanisms. So all of these studies, including ours, are studying the role of chemotherapy and cognition. You can see that it's a lot now, but also it's possible to evaluate neurobiological mechanisms. But we can do more. We can evaluate the age, the impact of age when you receive chemotherapy. You can do longitudinal studies. You can evaluate some comorbidities in animals. You can see them. You can evaluate risk factors, of course, neurobiology. Evaluate some specific biomarkers predictive of these cognitive dysfunctions in patients, but also in animal models. But mainly, you can now try to use neuroprotectors to make prevention, antioxidants, for instance, to do prevention of the cognitive deficits induced by chemotherapy. So animal models can be fine, but you have to know how to work that. So I would like to show you the first example of what he did first, with chemotherapy. We evaluate 5-fluorouracil by systemic injection, in animals with 1 injection per week during 3 weeks. So it means 3 injections. We wait for 3 weeks, and we decided to investigate cognitive functions in animals. I don't know if you know really or not at all how we can investigate, for instance, learning processes and memory in mice, for instance. We use this specific swimming pool, so you will probably love, but I will explain you the process. We use this specific swimming pool. In the first day of the training, we put a mouse, you will see my video, into the swimming pool, and you can see here there is a platform that is immersed just here, but the mouse doesn't know that the platform is there because you can see that water is black. And the mouse has to learn that the platform is there. So the first day, the mouse can just find the platform. She will just swim and find by pure hazard where is the platform. This is the job for the first day. But days after days, the mouse will remember that the platform is there because she has some specific symbols around the swimming pools. And the 4th day, you will see that the mouse will find immediately the platform. So she learned very well how she can find the platform. So she learned. And this is why we would like to evaluate. I hope it will work. Yes, you will see. The first day, here, you can see that she's fine. It's okay for her. She's swimming, trying to find the platform. So of course she can't because she doesn't know where is the platform. But at one time, she will find. The 4th day, you will see. They are very good. So she learned after 4 days where is the platform. So we can now study if the mouse treated by 5-fluorouracil is more or less able to find the platform. This is here to learn how to learn some processes. We didn't find any modification in that process of learning memory, as you can see, in young and aged mice treated by Pharmaceutical. However, we investigated another process, and this is something more real in our life. What we have to do in our life, we have to adapt every day to each situation. So it means that one day you have to program, the lunch, you have to call, you have to do things, and something appears, and you have to adapt your program to the novelty. So to reproduce this phenomenon, this is a multitask, activity we have all every day. We use this specific test. So as you can see, the mouse learned very well. After this period of learning, now we decide to change the position of the platform. You remember the platform was there, now the platform is there. We will put the mouse, and the mouse will come here. We'll see that the platform is not there, and she has to think, okay, the platform is not there, I have to go somewhere else to find it. If the mouse is fine, is normal, the mouse will do that and come back there. If the mouse is treated with a specific agent inducing modification, she will persist in this area. This is a reflex of a deficit. I will show you. You can see that this mouse will try to find the platform there. It's normal. The first day, it's normal. She learned that the platform was there. But now, she has to adapt. And she has to think that the platform is somewhere else. So this is the first day. And we do that during 4th day. And what you can see is you have improvement here of the ability of the mouse to find the platform after 4 days. So she adapted and learned again. In that process, we find a difference after 5FU treatment of mice. And what we can explain from this specific neuroscientific test is that behavioral flexibility of mice are specifically modified by 5FU and at long term after the treatment period. Just to summarize what I told you, here you can see the strategy of the mice to find the new position of the platform. Here you can see saline mice, so they just immediately after 4 days, they just immediately find the new position of the platform and not, mice treated by 5-fluorouracil. I can show you the saline mice. You will see. She will be good. And the 5FU treated mice that will persist here. So these data demonstrated that 5-fluorouracil, long term after the end of the treatment period, is able to alter behavioral flexibility. The problem of behavioral flexibility is adaptation to novelty. This is something that can be very difficult in your life. And because we know that chemotherapy alters probably division of cells, this is the same in brain, and 5FU is able to cross the blood-brain barrier, we investigated the possibility that neurogenesis in brain may be affected by chemotherapy in general, but by 5FU in particular. So just to summarize you some localization into the brain, this is the brain of mice. And you can see that you have neurogenic niches here in the hippocampus. So hippocampus is leading memory. And you have also neurogenesis here. So here we think in neurogenic niches that neurogenesis may be affected in the hippocampus and prefrontal cortex by chemotherapy and may potentially induce behavioral flexibility deficits. You can't see anything, but you can trust me for sure. Here we investigating the proliferation in the hippocampus in mice treated with 5-fluorouracil. The dots in greens are each neural progenitors dividing into the hippocampus during the treatment periods. Just you can trust me, but in fact we have really less dividing neural cells in the hippocampus after the 5FU treatment, as you can see here. And also in vitro, on neural stem cells cultured as neural spheres, you can see that 5-fluorouracil is inducing dead cells really directly and even at 10-8 molar concentration. So these data demonstrate that 5-fluorouracil is altering neurogenesis into the brain. This is probably the same in patients, and may induce alteration of behavioral flexibility. And this effect is an effect at long term. So now we validated the animal model for chemotherapy, but what about new targeted therapies? It could be the case, to investigate, it could be very important to investigate the role of specific anti-angiogens, for instance, anti-VEGF, so antibodies, but also it could be very interesting for inhibitors of PA3 kinase, for example, or immunotherapy. We are quite sure that brain-specific dysfunctions can be observed after these treatments. Just to summarize, but it's not the topic of the talk, it's just how it works. We will work with antibodies directly against VEGF-N. Probably you are working on cancer, so you know very well this molecule, so bevacizumab. And the idea on cancer is to block the activation of the VEGF-R receptors and to block proliferation, angiogenesis, and survival of cells. So how it works during hypoxia, you have VEGF that is secreted and angiogenesis that can irrigate the tumors. This is what is targeted in tumors. But some new and interesting investigations reported some cases reports with sunitinib, so the specific inhibitor of the VEGF-R receptors. You can see that we may have in renal cancer patients some verbal deficits, temporal disorientation, or cognitive troubles. For breast cancer patients, we can see leukoencephalopathy, it's very well seen here. and with bevacizumab, so the specific antibody directed against VEGF-A. We can detect attentional deficits and deficits of short-term memory. Also, it was previously demonstrated that injection in mice of VEGF may impact cognition, and we obtained this information from animal models. So it was done by the same type, of protocols I explained you. So the Maurice Wetter maze, and also here it's another one, but don't worry about that, to demonstrate that the VEGF itself improves cognitive functions. Also, injection of VEGF induces, you can't see that in red here, but improvements of the vascularization in the hippocampus and increase of the neurogenesis in the hippocampus when the VEGF is added into the brain biology. It's not possible to switch off the lights, please. Excuse me? It's possible to switch off the lights there because we can't see any reactivity. So what we did, this is a protocol. So I would like to remind you that bevacizumab is specific from the human VEGF. You probably know that. It's very well done by Roche. In fact, this antibody, it is commercialized by Roche to demonstrated that it is very specific to the VEGF from human. It's not really true, I have to tell you, because we saw some mechanisms in mice also. But because we knew that it was not very efficient in mice, we decided to ask Roche, thank you very much, an antibody specifically directed against the VEGF from mice. And we obtained this antibody thanks to Ferrara, the very big researcher, to find bevacizumab, and we obtained these two antibodies from Genentech and Roche. So remind that B20 is a good antibody directed against the murine VEGF-A, and bevacizumab is used here as a control in our model, and saline. So what we decided to do is to reproduce the clinical experiment for cancer. So we made administration every 4 days to animals by intraperitoneal injections, and we wait for 1 week approximately, and made this type of evaluation in animals. So I will not show you everything, but we evaluate anxiety, depression, spatial learning, spatial memory, I showed you, flexibility, I showed you, spontaneous activity, exploration, reactivity to novelty, and then we injected the RDU in order to measure neural proliferation into the brain, and we investigated, in vitro and in vivo experiments. What we saw is that we have no strong modification of the weight gain in animals treated by the B20 and bevacizumab, but we have significance for the B20 at the beginning of the treatment period, but it's nothing comparing to the impact of chemotherapy in animals when we treat them during 3 weeks. So it's not very important, so it's fine. If animal does not lose weight, it's fine for them. But we reproduce the experiment, as you know now, you are very specialist, and what you can see, we have no modification in that case of behavioral flexibility, but we observe a treatment effect on the learning memory. So this delay you can see here in the learning processes signifies that we have deficit in the learning processes in mice after treatment with the antibody, a systemic treatment with the antibody. So we investigated neurogenesis as for chemotherapy, and of course, we have no effect of the treatment with bevacizumab on neurogenesis. Why? Because neurogenesis is connected to flexibility, but not to learning memory. We also investigated in vitro neural stem cells viability. No effect, no significant effect of the two antibodies. Because of the studies, we also investigated vascularization in the hippocampus. We observed no specific alterations of the vascularization of the hippocampus under anti-VEGF treatments, and no modification of the endothelial cell proliferation in vitro after treatments with the different antibodies. However, we know, because we are neuroscientific, that learning processes are associated to a specific mechanism. This is neuronal activity into the hippocampus, and more specifically in the dentate gyrus, CA1 or CA3 area. we observed is modification of the cytochrome oxidase activity. So we measure that, by using the aminobenzidine on brain slices, and we measure, by force colors the difference in the formazan production. What you can see is that after treatment with the B20, we can see specific inhibition of the cytochrome oxidase activity that is a mirror of the neuronal activity at the time of the treatment period. We can't detect any neuronal activity differences in other brain area in these mice, demonstrating that the B20, when it's administered systematically, is inducing specific modification into the hippocampus and specific modification in the CF3 specific area. This specific area is known to be involved in the famous process named long-term potentiation. This long-term potentiation is involved in learning processes. So because we know that we investigated specific proteins and specific signaling pathways involved in the long-term potentiation in extracts from the brain, from the three groups we had, saline, bevacizumab, and B20, what you can see is what we observe, the specific phospho-KMK2, PSD95, and phospho-12 were diminished in levels, in Western blot were diminished in mice after the end of the treatment periods with bevacizumab. So finally, to conclude and to be short, we first demonstrated that chemotherapy induced behavioral flexibility and decrease of hypocampal cell proliferation. And we think that it involves hippocampus and prefrontal cortex. But some targeted therapy as bevacizumab are inducing deficits in learning, memory, and long-term potentiation. And we think that this mechanism is through the antibody here, targeting the EGFR2 receptors, interacting with NMDA receptors, and blocking the mechanism of long-term potentiation and memory processes. And because we think that these mechanisms are just the first story of a long study, because each molecule administered to patient may potentially impact brain functions by these different types of mechanisms, depending on the mechanism of the molecule you are using. If it's immunotherapy against cytokines, if it's anti-VEGF, if it's inhibitor of PI3 kinase, it may induce specific modification into the brain. Because of that, we built a specific international platform that we named Cancer and Cognition with clinicians, and we aim to target specific drug industry and also oncology intergroups. But also it concerns all molecules you will administer to patients. How we control the impact into the brain at short term and at long term. This is something we can take care. And we decide to propose specific expertise with clinical trials, with neuropsychologists, with statisticians, and also the preclinical studies with detection of biomarkers in patients, in plasma of patients, but also in animal models, in order to propose specific models of neuronal evaluation and neurocognitive dysfunctions, and to, of course, allow also big pharma, for instance, to discriminate the best molecule they have to propose for the FDA, for instance, for approval. Because at the end, for cancer treatment, you will have to decide the best cancer treatment for which cancer, but also the more efficient, but with the less side effects. So if you want to contact us, of course you can. And to finish, I would like to present the team. It's a very short team, and here, and also I would like to congratulate Dr. Martin Dubois, a postdoc that was financed by Novartis to investigate the impact of some molecules they want to have in the pipeline, to investigate side effects, because they want to find the best with less side effects for patients. Thank you very much.
Now, questions?
Don't worry, if you have not, I understand.
I have kind of a joke. Did you make a comparison test the EGF levels in IQ individual?
In animals or humans?
No, in humans.
Yes, in fact, we have clinical trials, totally, homogeneous.
Oh, it was a joke, but you are doing it?
Yeah.
Yeah, really?
Yeah.
Okay.
Yeah. In fact, it's led by Florence.